Welcome to the MRO Exchange, Connecting Healthcare Executives, your go-to podcast for staying informed in the dynamic healthcare world, where MRO discusses industry trends and topics with prominent healthcare leaders. In each episode, we delve into the intricate landscape of the U.S. healthcare system, shining a light on the immense responsibility shouldered by providers to effectively acquire, manage, and share clinical data with data consumers. Join MRO experts and healthcare executives as they navigate the important dynamics within this highly complex environment. From the surge in healthcare ecosystem demands to the influx of structured and unstructured data scattered across diverse systems, along with the ever-growing compliance, security, and privacy expectations, the MRO Exchange, Connecting Healthcare Executives, unravels it all for you. Tune in for a comprehensive exploration of the pressing issues shaping the healthcare industry today.
Hi, everyone, and thanks for tuning in to The Exchange, where we connect with healthcare executives on important topics facing the healthcare industry. I'm your host for today, Don Hardwick, and you can learn more about MRO on our website at MROcorp.com and can connect with me personally on LinkedIn. This week, we were in beautiful Salt Lake City, Utah at the American Health Information Management Association's national meeting, and we were talking to Lauren Wall, who agreed to share with us her impression of the association's meeting and what she got out of that. So, Lauren, thank you for joining the show today.
Always. Thank y'all for having me.
Lauren, I don't know about you, but it turned a little bit chilly on me. And for a Southern boy like myself, those snow-capped mountains looked awfully intimidating out there.
Don, I had to pack 3 different seasons worth of clothes just for 3 days of a conference. So I completely agree with you.
You know, I even checked the weather, and it didn't seem like it was going to be as cold as it actually turned out to be. I was not prepared in the clothes area to have been kept warm while we were out there. But
yes, sir.
I will say that to our listeners out there, if you've never been to Utah, take advantage of it and put that on your bucket list of places to go, because it really is a beautiful, beautiful place out there. So, Lauren, I talked to several people while we were out there this week, and the resounding message is that this AHIMA meeting was one of the better meetings in terms of the topics that were being covered, as well as the content of the topics that were being covered. And to name a few of those topics was the new AI involvement in applications in the healthcare industry was one of those topics that people were talking about. Preventing cybersecurity attacks, revenue cycle management, and applying the HIPAA rule for reproductive health. Those were kind of the buzzwords and the buzz sessions. Did you hear anything different, or were you pretty much in agreement with that?
No, I do agree with that. And I really loved how the conference this year separated it very clearly into the 6 organizational tracks that they developed so that you could focus on certain ones that were very passionate for you, or maybe where you felt like your organization needs to focus in the future. So it made it very easy to follow too.
Yeah, that's a good point. You could line yourself with a track that was, most important to your organization or fit in the job description that you currently hold or your role that you currently hold. So, what do you think about the topics that were covered? Are they applicable, or are they ahead of their time, or are they things that the associated folks that were at the meeting are going to be able to take back to their organization and begin to apply?
Well, Don, if you know anything about HI and its sector, you know that nothing ever fits in a box. And I don't think anything is ever ahead of its time. I really feel like with our organization, they have taken that under consideration and really focused on what's happening now, what's coming, where can we better prepare ourselves. And that's really what I feel like me personally, I was able to do here. I could focus on what I want for my career, my goals, and what I want to bring to my organization and better serve all of the people around me and that I work with daily.
That's the intent of any of these should be that let us give some information to our attendees so that they can, as you say, either benefit your career or take back to your organization and benefit the organization. So let's expand on that a little bit if we could, and tell our listeners the track that you decided to be involved in, number one, and then number two, what tidbits of information that you took away from there that you feel like would solve or help augment your career or your organization.
Well, if anybody's ever met me, they know I don't fit into a box. So there were a couple of the tracks that I focused on, mainly the emerging trends and operational outcomes. I am very much into operations for HIM, and I wanted to see where I might could grow myself and my future to help my teams around me. So that was my area of focus mainly for this AHIMA 2024. I was able to learn more even about creating a mid-revenue cycle team. I went to WVU Medicine's presentation and got to really learn how they, in a short amount of time, were able to create an all-encompassing mid-revenue cycle team. So with that, as we know, you have from CDI to coding to HIM operations, but data analytics plays such a high part into that. And I believe that's where we're going, right? We want to have that team that can support one another and push it through. So for me, it was neat to get to see more of a side that I don't play a role in from the HIM operational side. I really listened to them, how they brought in that data analytics to bring all of the teams together, to show where everybody can positively better impact one another. I have found that I've done a lot of that over the last 5 years, really creating shared services teams for my organization. And it was neat to get to see other ones that are really bringing those components together. I went to one session over revenue cycle outcomes for HIM optimization and collaboration that discussed auto retrieval of records and then standardizing your audit processes. That's something I beg for. That is something I want. That is something that interests me so much. You mentioned AI a while ago. How much has AI came into play for us over the last few years? It is hitting us in record retrieval. It is hitting us in getting letters from insurance companies, ingesting that into systems that, as we know, the quicker we get it, the quicker we can turn the records out and payment. Everybody wants to know when they're getting paid for an account, and especially on pre-bill audits. I feel like that was something hearing the three ladies who spoke to how their organization has brought that application in and really utilized it and getting to see metrics. Nothing speaks more to me than getting to see the data, how it has affected them, how they have grown with it. And that was something that I really loved getting to put my hands on, see the data, see where they've been able to grow it to. We always talk about we want to receive everything quicker, but they're actually doing it. So that was probably one of my favorite sessions, just because I want to see where we can take it in the future. And then I went to one about growth and change. And anybody that works in the AI arena knows you have to be ready to grow and be open to change because if not, you're going to get left and you're not going to be there to have a future. And it talked about the positivity of that. And it was motivational. And sometimes we get stuck in a rut or we get stuck in a certain career path and we're around people that might or might not want to change. But going to that one session really pushed me to want to do more, to want to be more, whether it's at my job or whether it's helping in the HI arena of maybe volunteering for a HEMA in the future, or where can I take myself in the next 20 years in my career. So that one, it meant a lot, I would say. One of the speakers had gone through a horrible year, and yet she still showed up whether it was virtually or not because of her condition, but she showed up and proved to us that you don't give up no matter if it's in your career or not. So I really love that. And then finally, Don, funny enough, I went into the wrong session one of my rounds, misread the letter wrong, sat down, happened to be working because when do we ever get to go to a conference and not work? And I completely missed the session I planned, but once the session started, I got to listen about the problem list. And I started thinking about how many times I've complained about a physician picking up a problem on a problem list that shouldn't be active, that's historical, and how that affects the patient care of that patient. But then it goes through all of the steps to revenue cycle and billing, and maybe CDI has to have their hands in it because you have to get clarification on something that you see a patient's not being treated for. From an operational standpoint, I really have to focus on that because of patient amendments. Patients see something, they're like, I wasn't being treated for that. So we have to focus on that from start to finish. And even though it wasn't one that I had planned to go to, I really got to experience how it affects and the auditing that maybe should be done more on that because of how much it affects everybody from start to finish. So I really did feel that the energy for AHIMA this year was infectious. Dawn, I don't know if you got to experience that, but it just seemed like everybody was so positive on what's to come and the advancements that they're really wanting to help us with as HI professionals in our career and growth.
Yeah, I would agree. The feedback I got all during the conference was nothing but stellar this year compared to some of the years in the past. You go away and you go, what did I learn? And you go, maybe I didn't learn as much as I would hope to. But this year, I would agree with you. The sessions appeared to be very informative and stuff that people could take back and use. Yeah, I want to touch on a couple of things here. You talked about a little bit about the rev cycle piece of it, and how I'd like to expand on that just a little bit of how you see rev cycle and HIM intersecting here. I know there were some sessions here, and if you pick that rev cycle, category, you probably heard a lot about how those two departments are, acquiescing to make a common goal between HIM and rev cycle or the business office. So, did you hear anything that you could literally put into play or into practice in your organization?
I would say that's something that I focus on daily. Um, for myself, that is something that is actually one of my sectors that I'm over. So I really paid attention to that when they were discussing the mid-revenue cycle teams and such, because I I feel like that can be expanded on and grouped together so much. I myself wanted to maybe speak with them about what they are really doing for their ROI sector. So that's something that I have created with my team is that BOE aspect of releasing information for the revenue cycle and appeals and audits and such. So unfortunately, I didn't get to hear that in there. Now, I'm pretty sure they probably take care of it and do it, but I wanted to almost go up and be like, "Can I powwow with you and discuss this on where I have seen it and where they might have seen it?" Just for the fact of I cross over to the revenue cycle daily to ensure that their documents are going out timely and efficiently through our ROI BOE aspect. So I really wish I would have heard more on that, Don, just because I do feel like we cross over every single day together.
You mentioned expediting, and one of the things that the information to the payers and so forth, and you mentioned auto retrieving the records. Can you explain that a little bit more to our audience?
Sure. So right now, depending on what EMR you have, there is applications out there that does auto retrieval. So it will ingest a request from an insurance company, depict what it wants, and then it is incorporated within the EMR to go and pull that record and what data service that company wants, pull it out and upload it to that payer. So it is something that I'm very passionate about and I want for my future. Um, I happen to be on an EMR that we're hoping to test it within the next 6 months, but I do know some of the major EMRs are already doing it well, and they're really seeing that turnaround time go from, say you're sitting at 7 days getting it out because manually you have to find somebody, but then auto retrieval's able to do it in 1 to 2 days. Like the amount of time and energy and FTEs that it can save you, you can't beat that nowadays with how many requests these insurances are sending, which we know is astronomical.
Yeah, I see a big influx of volume for very specific type of, I would say, use cases. Medicare risk adjustments and commercial risk adjustments are probably the two of the highest volume request types in a facility, and expediting that information seems to have multiple benefits. Do you see that benefiting both parties, both the payer and the provider, or hospitals in this case? Do you see it, assisting in improved collections or improved cash flow? And if so, what about the insurance payers? Are they seeing a benefit from that quick turnaround time as well?
Well, I would say that the biggest benefit for an insurance company that thinks that they're going to review that many accounts is going to be standardization, right? If they're getting the same chart pool that all other chart pools are done, it helps better ingest into their product because maybe they're using an AI system and looking for certain keywords, or maybe they do have actual teams reviewing these thousands of records that is wasting time. But, I think standardization of those records being pulled does benefit them. But for us at the healthcare actual providing the records, of course, it helps us not only with billing and turnaround times for payment. I feel like it probably leads to less denials too, because the time frame that you're able to get it out, you're not going to get a technical denial. It's going out the door. You're not going to get something lost in snail mail. How many times have we gotten denials just because, oh, I'm sorry, the mail didn't get there in time, or maybe it went to the wrong box. It could be one insurance company that has 15 mailing addresses. So I really do feel like there's so many benefits to the auto retrieval with AI that makes me want to just have it even more to see where we can benefit from it.
Yeah, it seems to be the thing of the future, for sure, because it does reduce the labor cost. And most people don't understand the volume of requests for information that comes into a hospital on an annual basis. But I know from a company standpoint, the volume of risk adjustments, and they call them audits, but they're more reviews, but still, nevertheless, that come into a hospital are astronomical. We do, I know, about 1 million requests for records per month, and about 40% of those are some type of risk adjustment or requests that are for a payer-related request, whether it's federal government, whether it's state government, or whether it is insurance. Those three categories, the volume coming in across the country, and we have a very wide footprint of facilities around the country, but still the volume is astronomical. And if you don't apply some of that technology, the labor that it takes to do it, and as you said, mistakes and that type thing, human beings, processing this volume of requests, you're going to have issues from time to time, but automating it takes all of that out of the equation. And the more we can improve in that automation, the better off we're going to be all the way around, I think. Anything else, Lauren, that you heard that was exciting from other people you talked to?
I just think everybody's really excited on what's to come with the future. I know that AHIMA has a lot of stuff for career growth that they're looking at implementing that will really help, especially the new students. I myself, underneath me, have one new graduate that just completed her degree and will be going for her RHIT. And so I feel like even though I've been in the industry for around 15 years now, what's to come for the ones that haven't been and where it can really push them. And then even I'm excited that 15 years in, what can it mean for me? So I think that's the biggest thing going into 2025 with AHIMA, and to see what's coming for the next conference is where will they step up for us leaders in the industry and where they can help us grow even more.
Yeah, I think this profession certainly has its advantages and a definite career path. I've been in this line of business for a number of years here and never have regretted it, not a moment. So it does have a bright future. How we go about applying, this profession is changing because of automation and because of some of the changes in regulations and so forth. And there's always something new that's coming down the pike, and it's very enjoyable. I've never regretted my choice in professions at all.
I have not either. I think it's nothing but been a positive thing for me. And I do believe that the relationships that have been created over the years too have also built this organization. So everybody always says it's a small world, but you get to AHIMA and you turn around and you're like, oh, wait, hi, I know you. I've been connected with you on LinkedIn for 15 years or what have, so it really is pretty interesting on how small of a world it really is.
Yeah, I couldn't agree more, and it gets smaller, it seems like. Lauren, thanks for joining the show today. I really do appreciate you taking the time out of your schedule to sit with us and chat with us of what you heard and what you've learned at AHIMA this year. So very, very nice talking with you.
Thank you so much, Don. I look forward to it for next time, maybe.
Absolutely. Thanks, everyone, for tuning in today. And be sure to give us a listen on our future sessions. Until we talk again, I'm your host, Don Hardwick.
You've been listening to the MRO Exchange, where we connect healthcare execs. For more insights and to hear other healthcare executives' exchanges, visit the show's page on MROcorp.com and be sure to explore additional resources and thought leadership articles. You can also check out the program page on healthcarenowradio.com. Finally, be sure to connect with us on LinkedIn or X at MRO Corp. Until we talk again, this is the MRO Exchange, where healthcare execs connect.